My name is Dr. Byron Cryer, and I serve as a gastroenterology expert for the American Gastroenterological Association. I've been a member of the gastroenterology faculty at the University of Texas Southwestern Medical Center at Dallas since 1992, and I guide the Gut Check campaign to educate patients on the preventable gastrointestinal health risk associated with taking too much over-the-counter pain medicines. September marks Pain Awareness Month. This serves as a time to raise public awareness of issues in the areas of pain and pain management. Thousands of generic and brand name over-the-counter and prescription products are available at pharmacies, drugstores, and local retailers. While their names may differ, many share the same active ingredients. Many of us turn to our pain medicines without really knowing the active ingredients and the potential overdose risks. The two most common active ingredients in our medicine cabinet are nonsteroidal anti-inflammatory drugs, or NSAIDs for short, and acetaminophen. NSAIDs are found in more than 900 over-the-counter and prescription medicines. These include aspirin, Advil, Motrin, and Aleve. Acetaminophen is found in more than 500 over-the-counter and prescription pain medicine. These include Tylenol, NyQuil, Dayquil, and Theraflu. When an individual takes more than the recommended dose or more than one medicine with the same active ingredient, they put themselves at risk for serious gastrointestinal health complications. The AGA, with the support from McNeil Consumer Healthcare, worked with survey expert Harris Poll to field the Gut Check Know Your Medicine survey. The survey was conducted online from September 30th through October 8th, 2015, and we heard from 1,015 U.S. adults 30 years of age or older, including 479 who currently experience chronic pain, along with 251 licensed gastroenterologists who are office or clinic-based and see adult patients 18 years of age or older. Next, we'll delve deeper into the survey findings and review the common myths and misconceptions regarding over-the-counter pain medicines. Americans report commonly experiencing headaches, backaches, and muscle pain and turn to OTC pain medicines to get relief. More than 8 in 10 consumers, or 85%, have used OTC pain medicine in the past year, and almost 4 in 10, or 38%, have used a prescription pain medicine. What gastroenterologists are finding is these Americans may be taking too much over-the-counter pain medicines to relieve some of their symptoms, which can lead to harmful gastrointestinal health complications. While many Americans report that they're in pain, on average, a gastroenterologist sees 90 overdose cases per year due to over-the-counter pain medicines. There are safe ways to manage pain, and in recognition of Pain Awareness Month, the AGA is urging consumers to be aware of common myths and dangerous misconceptions surrounding OTC pain medicine so that they can get safer, smarter pain relief. One of the common myths surrounding OTC pain medicines is drug labels are just guidelines, with 40% admitting they know what works for them. American consumers take appropriate safety measures in many aspects of their lives. For example, most people wear seat belts when riding in a car, or install smoke detectors in their home, and use antivirus software on their computers. Reading medicine labels should be no different than taking these safety measures. Yet only 32% of people say that they always read the drug fact labels on an over-the-counter pain medicine that they haven't taken before, which can be a costly or even a fatal oversight. Fact: medicine labels and your personal health conditions change over time. Read and follow the drug fact labels every time, including maximum daily dosage and warnings to avoid potential overdose complications. Labels help identify the active ingredients, dosages, alcohol consumption warning, age warning, existing or past health conditions, and potential drug interactions. Simply put, labels are not guidelines or suggestions. Reading and following the drug fact label every time, including maximum daily dosage and warnings, is is the only way to avoid costly or even fatal overdose complications. Myth 2. Taking more than the recommended dose is harmless. Another myth that consumers often believe, when in reality, overdosing on an OTC pain medicine can be easy and more dangerous than we think. According to our survey findings, 1 in 4 Americans is willing to take more than the recommended dose of OTC medicines because they believe that their symptoms will go away faster. An overwhelming 95% of gastroenterologists say that patients could avoid unnecessary hospitalizations by educating themselves on OTC pain medicine risk. The fact is, more medicine will not provide faster relief. Patients should work with their doctor on the proper dosage and treatment for their individual health situation. While patients might exceed the recommended dose for weeks or even months without complications, it can just take one occurrence to put them in the hospital. There is a real opportunity out there for education about proper use of OTC pain medicines. Abdominal pain, nausea, and ulcers are most common symptoms of overdose. However, complications are not always recognizable. So in fact, I recently had a patient which demonstrated some of these concerns. So this patient was a 37-year-old, otherwise healthy woman who came to the emergency department following 2 episodes of vomiting blood. Interestingly, she had no abdominal pain. She had been taking over-the-counter ibuprofen for 4 days for knee pain after working out with aerobics. And when I examined her abdomen, she had no tenderness. We performed an endoscopy, which revealed a 1 centimeter bleeding ulcer in her stomach. We admitted her to the hospital and she recovered just fine. Interestingly, when talking to her a little bit more about her pain medicine use, she said that she did not know that she could get a bleeding ulcer from ibuprofen, and that she thought that because the ibuprofen was over the counter that she could safely take more than the recommended dosage. And she was surprised that she had an ulcer because she had no abdominal pain prior to coming to the emergency department. Myth number 3. Mixing medicines is safe and effective. A minor headache, seasonal allergies, sore muscles, recent surgeries, all of these scenarios put us in situations where we unwittingly may take multiple medications with the same ingredient at the same time to manage the pain. On average, a gastroenterologist sees 90 overdose cases per year due to OTC pain medicines. 65% of gastroenterologists report that their patients were unaware of the risk of taking more than directed, and when overdose complications arise, the mistake often involves taking 2 or more medicines with the same active ingredients at the same time. Many of the consumers we surveyed, in fact 48%, are unaware that both acetaminophen and NSAIDs are present in more than 1,400 over-the-counter and prescription medicines. Taking more than one medicine with the same kind of ingredient at the same time can cause an overdose. Patients should take only one product that contains acetaminophen at a time, and they should take only one product that contains an NSAID at a time. Just as a reminder, NSAIDs include medicines such as ibuprofen, naproxen sodium, and aspirin. So going back to our previous patient example, the 37-year-old woman who I recently saw, it turns out that she had been taking more than one pain medication. She was taking ibuprofen for her knee pain. However, on the day prior to presenting with bleeding, she had a headache and took aspirin for the headache. By taking the aspirin and the ibuprofen at the same time, she was taking 2 products which contained NSAIDs and was overdosing herself on the combination of the NSAIDs, which unfortunately led to her development of the bleeding ulcer. Practicing safe pain relief is simple. Patient-provider communication is key for patients to understand the best treatment for their situation. Patients should talk to their doctor about all the medicines they are taking, and doctors should initiate the conversation at each visit. These survey findings reinforce that consumers should take time to check in on their pain relief habits, and Pain Awareness Month provides a good reminder to do this. Always read and follow all medicine labels. Only take one product at a time containing the same kind of active ingredient. Talk to your healthcare professional about all the medicines you're taking, including the over-the-counter medicines. Everyone plays an important role in helping consumers avoid complications from overdoses of OTC pain medicines. Too many patients go to the hospital for avoidable and preventable gastrointestinal complications. When we developed this campaign, we knew there was a need for greater attention and awareness for the millions of people who rely on OTC pain medicines. It is critical for us to shine a light on those who are suffering from pain and to provide the information to help motivate and encourage them to be smarter and safer the next time they reach for medicines. For more information, visit gutcheckfacts.org.